Good morning to everyone. I think that now we are ready to start. There are very many participants connected, so I would like to thank you in advance for your time for this last, I'm sorry to say, webinar on environment and health tools, but there will be many more on different topics. I would like to start by thanking our fantastic and great colleagues in the Bonn office in the WHO European Center for Environment and Health. Thanks to them, we were able to organize these webinars, which were very much attended and appreciated by many of you. You know that we started these webinars about a year ago, and there were 7 of them. Each one of them was devoted to a specific tool which was developed by WHO and by the Bonn office on different topics. And now we are devoting this last hour, this last webinar, to a very important topic, noise pollution. Given that a couple of months ago there was a new important WHO publication, Environmental Noise Guidelines for the European region, and we are very lucky today to have Dr. Dorota Jarosinska, who is the program manager, living and working environment. She's speaking from Bonn, WHO European Center for Environment and Health, and I would like to thank her for her availability to give this talk today. And after her presentation, we will have, as usual, ample space for questions and answers from your side. Please, while she is presenting, please note down your questions, and please channel all your questions through the chat of the WebEx. Then we will ask Dorota for her answers. Just to be clear, we are speaking today about this publication that I don't think that you can see, but still it's the front cover of the publication that you find on the WHO website, the WHO European website. And Dorota is going to explain all the different parts of this publication. Actually, when I was reading these guidelines and the executive summary, it's really striking because when we think about noise, I think that we think that it's like kind of something which is bothering us, but maybe we are not thinking of the severe health consequences that noise pollution is having on us. Also, in terms of important health outcomes. So I'm sure that Dorota is going to also to speak about these important effects. And I just remind all of you that in order to avoid, as someone said, noise pollution from this WebEx, you are all muted. And I hope that this will increase the quality of the sound from Dorota microphone. Okay, so Dorota, the floor is yours. Thanks once more for being with us. And personally, I am very much looking forward to learning from you about this important document that you yourself coordinated. So congratulations for that. I know that it was a huge undertaking, but I also know that it was hugely appreciated, and so I guess this is very much rewarding. I hope that also the participants to this WebEx will implement these guidelines, and so this hour that we spend together will be a good investment also for you through the RHN participants. Dorota, the floor is yours.
Okay. Thank you, Francesco. Good morning, Francesco. Good morning, all colleagues who are joining us today, and thank you for making yourself available and wanting to spend this hour to hear more about the environmental noise guidelines for the European region. Indeed, as Francesco said, this is part of the presentations of a series of presentations on environment and health tools This one is a slightly different tool as compared to some softwares or calculators we have developed, but it is an extremely important tool as this is a guidance for member states to implement measures to protect population health from adverse impacts of exposure to environmental noise. So in my talk, I will very briefly mention the burden of disease, the magnitude of the issue, aim and scope of the guidelines, and then guide you through the process of developing the guidelines, the key results, recommendations, and also to look a little bit ahead. Francesco has rightly observed that noise sometimes is not being considered as an environment and health issue. It is sometimes perceived more as a mere annoyance, but not thought of seriously as a public health challenge. And it is not the case. I mean, first of all, the magnitude of exposure to environmental noise is substantial. We do not have estimates for the whole WHO European region, but for the EU countries, which are reporting under the EU Environmental Noise Directive, the estimates are, as you can see, roughly 100 million people exposed to road traffic noise above the threshold specified in the directive, and more than 80 million Europeans affected by nighttime road traffic noise, which can be the disadvantages to human health. And the estimates of the associated burden of disease conducted around 2010 are pointing out also to the substantial burden on health, with the overall loss of more than 1.5 million of healthy years of life due to road traffic alone, and only in the part of Europe for which we have sufficient data. So I believe that this is a convincing argument to really get the guidelines to support member states to take actions. We also got a very clear policy signal. If I talk about WHO and our European Environment and Health process, in 2010, at the 5th Ministerial Conference on Environment and Health, member states explicitly requested WHO to produce guidelines that would include not only transport-related noise, but also additional noise sources such as personal electronic devices, toys, and wind turbines. And another policy context which is relevant for us, it is the EU Environmental Noise Directive, and especially its Annex 3 and the ongoing revision of Annex 3, which is focusing on the exposure response functions to be used to estimate the health impacts. Before going into details of how and what is contained in the environmental noise guidelines, I would like to stress and to make it clear what WHO guidelines are and what they are not. So WHO guidelines, noise, air quality, drinking water, whatever subject, this is a set of public health recommendations which are meant to assist different target groups, policymakers, technical professionals, public health, environmental professionals, and other relevant stakeholders, civil society, etc., to make informed decisions to protect the public health from adverse impacts, in this case of exposure to environmental noise. The guidelines are developed based on a comprehensive and objective assessment of the available evidence, and since 2012-2014, they follow a very rigorous process of development as outlined in the WHO Handbook for Guidelines Development, to make sure that these guidelines are as objective as possible, so that they are free from biases and really meet public health needs. But at the same time, it's important to stress that WHO guidelines are not standards. They are not prescribing limit values. This is part of the policy-making process, where other factors can play a role. But this is a distinction which I would like to highlight, as this comes quite often in the discussion, and some confusion arises about the nature of the guidelines versus standards. The guidelines I will be presenting now are not the first that WHO developed on noise. In 1999, the first guidelines for community noise were published, and in 2009, night noise guidelines for Europe became available. So we have kind of a continuum of public health advice provided on this environmental health risk factor. These new guidelines, they are aiming to provide recommendations which are evidence-based, on one hand on exposure-response relationships for a number of health effects related to exposure to noise, and on the effectiveness of interventions. And this is underpinned by a review of scientific evidence on a number of health effects, as well as systematic review of evidence on the effectiveness of different interventions to reduce exposure and to improve health. A long list of health outcomes has been included in the review of evidence, and these were clustered by the expert group, by the guideline development group, in those for which the evidence seems to be the most extensive, and these are called critical health outcomes, and those for which the evidence may not be as big, and they are called in this WHO guideline development nomenclature important health outcomes. These critical health outcomes include cardiovascular disease, annoyance, and we are talking here about the long-term annoyance, and sleep disturbance, and these two were the most important health outcomes considered in developing recommendations, but also cognitive impairment, as well as hearing impairment and tinnitus. And those important health outcomes include diabetes and other metabolic diseases, adverse birth outcomes, and quality of life, mental health, and well-being. The noise sources which are included and considered in these guidelines are specifically 3 transport-related noise sources: road traffic, aircraft, and railway, and wind turbines and leisure noise. So how did the process of developing the guidelines look like? So, as I said already, it is now a very structured and I would also say very demanding process. So following the first scoping exercise and defining the scope of the guidelines and formulation of the key research questions, the first step is to conduct a systematic review of evidence. Then, this collected and reviewed evidence undergoes the process of grading the quality of this evidence. And then, this is the basis of developing recommendations. And there is a number of groups of experts and stakeholders with clearly defined roles and responsibilities in this process. We have a WHO steering group, then a guideline development group, which is a central group of experts who are responsible for scoping the guidelines, for developing the questions to be answered by systematic review of evidence, who are then responsible for actually developing guideline values and formulating recommendations. A systematic review team, this is a group of experts who are conducting systematic reviews of evidence on specific topics. And then, last but not least, is the external review group, composed of both technical experts and stakeholders who are providing their comments and reviews at different stages of the guideline development. So, just to give an idea of who is involved when and where, so the WHO steering group is overseeing, of course, the whole process, systematic review process conducted by a systematic review team and external experts from external review group contributing to the peer review of these systematic reviews. And then grading of the evidence, it's mainly also with the systematic review team. And then, as I said, the development of recommendations is mainly with the guideline development group. But then at the later stage of the process, where the recommendations and the guideline document has been drafted, it has also been a subject of a consultation with external review group, both technical experts and stakeholders. And here I would like to stress that external review group, when providing comments, they were more on the factual side, on the clarity of messages, but not influencing the recommendations as such. Just to give an idea of how many people were involved, and indeed, as Francesco said, it has been a very demanding process, and the main credit goes to, of course, experts and stakeholders involved in this process. So this is the composition of the guideline development group. We had a wide international group of experts who contributed also their time and effort to prepare systematic reviews of evidence, and also a group of experts. Here we mentioned only the technical experts, not stakeholders, who provided also very useful comments. So this was a really big teamwork, and big words of appreciation go to all colleagues involved, because it was indeed a very, very demanding process. So the systematic review process. You will find systematic reviews of evidence for all those specified health endpoints, and also a systematic review on interventions to reduce noise and improve health. In the open access journal, it is a special issue of the International Journal of Environmental Research and Public Health, and all the systematic reviews are available there. Following the systematic review, as I mentioned, the next step followed with grading the evidence. And again, this is not a trivial task, because there is a whole list of criteria which are being used to grade the quality of evidence. And some of those criteria, like limitations in study design, inconsistency of results, indirectness of the evidence, imprecision or publication bias, these factors were used to downgrade the quality of the overall evidence, while the factors like magnitude of the effect, plausible confounding captured in the studies, and dose response gradient were used to upgrade the quality of the overall evidence. So the final judgment and assessment of the group was the following: so that the evidence on specific topic could be of high, moderate, low, or very low quality. This was quite a demanding process, because it follows the framework called GRADE, which is grading of recommendations, assessment, development, and evaluation, which is primarily developed for clinical guidelines. So you can imagine that to apply this rigorous criteria to environment and health domain, it's not straightforward. So there was a lot of effort made to adapt this grade system and to apply it. And one more remark, that this grading of evidence and statement on a low quality of evidence, it's not an assessment of individual study. So it's not to be evaluating this is low quality study, this is good quality study, but we are talking about the bulk of evidence, because this is very important then to formulate the recommendations. So not surprisingly, when we talk about high quality evidence, there is a strong sense of certainty that further research would be very unlikely to change the estimates and the effect. The evidence of moderate quality is that further research may have an impact on the certainty of the effect and the effect estimate. The evidence of low quality means that further research in this area is very likely to importantly influence the certainty on the effect estimate and can even change it. And when we talk about very low quality evidence, the effect estimate is uncertain. So this is the interpretation of this quality criteria. Then the process of developing recommendations. So we have the evidence reviewed in a systematic manner. We have the quality of this evidence assessed, and this is the main factor considered in developing recommendations, but it's not the only factor, because as prescribed in the WHO handbook, the guideline development group had also to look into so-called contextual factors. So the balance of benefits and harms of the planned recommendations, the dimension of values and preferences, and implications for resource use. So for values and preferences, yes, we can assume, and based on some surveys, that people value quiet places, quiet places not affected by noise, and that this would be their preference. But it's not that straightforward when we are balancing between the ease of going for holidays by plane and being free from noise. The balance of benefits and harms. There is a social gradient of who is benefiting and who is affected by noise, who is benefiting from noise generating activities and who is affected by noise. So these aspects were also discussed and considered when formulating recommendations, in addition to the quality of evidence. And then recommendations, they are formulated as either strong or conditional. And that depends on the quality of evidence and also these contextual factors. So in brief, a strong recommendation is such that it can serve in most situations to be used in the policy domain, and where there is a confidence expressed by the guideline development group that the positive effects of implementing recommendations will at large outweigh any undesirable consequences. And when we talk about conditional recommendations, then this is less straightforward when it comes to a practical real-life applications, because there is less certainty of this, how efficient these recommendations can be in practice, because we have lower quality of evidence, or we have very strongly opposing values and preferences, or we have explicitly excessively high resource implications. So this is the interpretation of the strong and conditional recommendations. To make things even a bit more complicated, keeping in mind all these previous considerations, the very process of how recommendations were developed followed the steps outlined in this slide. So we got from systematic reviews of evidence an estimate of exposure response function. So at these exposure levels, we have these health effects. First, the validity of these functions was assessed and checked. Then the lowest noise level measured in the studies considered was identified, but this is not yet a guideline value because the guideline development group decided and agreed a priori what is the smallest relevant risk increase for each of these adverse health outcomes considered, relevant at the population level. And then having these exposure response functions, knowing what's the lowest level of noise, and agreeing on this population relevant risk increase, the guideline development group decided on these guideline values for each source and for the selected priority health outcomes. So the guideline values included in this document are the noise exposure levels above which the group of experts, the guideline development group, was confident that it is associated with the relevant increased risk of adverse health effects. So for the selected priority health outcome measures like incidence of ischemic heart disease, incidence of hypertension, percentage of highly annoyed, percentage of highly sleep disturbed, or permanent hearing impairment, or reading and oral comprehension as an expression of the cognitive impacts, the guideline development group adopted and agreed through an expert judgment what would be the relevant population relevant risk increase which will be considered for setting the guideline values. So for example, for the incidence of ischemic heart disease, the group decided that 5% increase in the relative risk is marking this relevant risk increase. For the percentage of highly annoyed, a 10% increase in absolute risk would mark this relevant value. It is therefore important also to stress that these guidelines are not setting effect thresholds. We are not looking for the lowest possible, but this is building on the benchmark values defined by this relevant risk increases. Moving now to the results. So in brief, for transportation noise, the evidence was most evident. There was the most studies for road traffic noise, a little bit less for aircraft, and surprisingly little on railway noise. And based on the review of evidence, it became apparent that aircraft noise is associated with higher percentage of highly annoyed and highly sleep disturbed people than other types of transportation noise. And based on the evidence, it is possible to formulate individual recommendations for the specific transport noise sources using the LDEN and LNIGHT, which are the long-term average indicators of noise exposure. And based on the review of the interventions, substantial health benefits can be expected from substantially reducing noise. For leisure noise, the evidence is of very low quality. There are big challenges in properly assessing exposure and linking it to the auditory impacts, especially hearing impairment and tinnitus. And here a supportive evidence comes from occupational noise field, while for the leisure noise, this direct evidence is really very poor. For wind turbine, at the time of developing the guidelines, only very low quality evidence on the health outcomes was available. Actually, there were big challenges in assessing noise exposure, and also in the body of evidence reviewed, it was difficult to disconnect noise impacts from other considerations such as its visual aspects, infrasound, etc. And also the guideline development group was aware of many new studies which were conducted while the guidelines were developed, and it may be expected that in the coming years, this evidence may move from very low quality, hopefully, towards moderate. So with the revision of the guidelines, hopefully more clear guidance can be provided. And overall, when it comes to noise interventions, based on the available evidence, the most substantial evidence is for road traffic noise and less for aircraft. Virtually no evidence for rail, wind, and leisure noise. And so far, the most often studied health outcomes are long-term annoyance and sleep disturbance. When it comes to implementation of interventions, of course, they span a very broad range of interventions specific to different sources and the whole pathway. But in brief, it can be concluded that effectiveness of specific interventions is very much context specific. Also, the resource implications are highly variable. And across the board, it was stressed that the community involvement is very important when implementing any intervention measures. And a very general recommendation formulated that health needs to be considered in noise abatement measures and policy, and this needs to be very strongly visible. So what are the recommendations? For road traffic noise, this is just to give you an overview how a kind of a schematic presentation of the priority health outcomes considered, a reminder of what benchmark levels were adopted, and how for the road traffic noise the overall quality of evidence looked like. And based on this evidence, for road traffic noise, the GDG could strongly recommend reducing noise levels from road traffic below 53 decibel LDEN, meaning day, evening, and night, being confident that road traffic noise above this level is associated with adverse health effects. Similarly, for the night noise, the GDG strongly recommends not exceeding 45 dBl night. And when it comes to intervention-related recommendation, also the GDG strongly recommends that policymakers implement suitable measures to reduce noise exposure from road traffic in the population exposed to levels above the guideline values for average and for night noise exposure. For specific interventions, the recommendation is on reducing noise both at the source and also on the road between the source and the affected population through different changes in infrastructure. For railway noise, again, different evidence for these different priority health outcomes was assessed, and you can see how, in fact, little evidence exists. We have moderate quality evidence for the percentage of highly annoyed, and this allowed the GDG to formulate also the strong recommendation. And for railway noise, the values are 54 decibels LDEN and 44 decibels L night. And again, a recommendation related to interventions, but in this case, the guideline development group felt that there is an insufficient evidence to recommend any type of interventions over another. For the aircraft noise, based mainly on the annoyance, there is a strong recommendation to reduce noise from aircraft below 45 dB LDEN and 40 dB L-night. And again, overall recommendation for introducing interventions. However, for the type of interventions, the recommendation is mainly for suitable changes in infrastructure. For wind turbine noise, because of the body of the evidence, it was feasible only to propose conditional recommendation for wind turbines for 45 dB LDEN, and also for interventions only conditional recommendation because of the insufficiency of the evidence. And then last but not least, the leisure noise. And as already signaled here, the evidence was very poor, low quality. It wasn't feasible to really establish exposure response functions. And therefore, the group decided to follow the approach used in the previous version of the community noise guidelines and workplace prevention, and decided only to go for another indicator, which is the 70 decibels L equivalent per 24 hours of the yearly average, and the details are described in the handbook. So for leisure noise, there is this conditional recommendation for this for reducing the year average from all leisure noise sources combined to 70 dB, this LA equivalent for 24 hours. For keeping in mind the specific features of exposure to this type of noise, for single event and impulse noise exposures, the GDG is conditionally recommending to follow the existing guidelines and legal regulations which are in place to limit the risk of increase in hearing impairment. And when it comes to interventions, even if in light of this limited evidence and following a precautionary approach and to reduce possible health effects, the guideline development group strongly recommends actions to prevent exposure above the guideline values for average noise and also for single event and impulse noise exposures. And this is especially relevant for young people and for potential hearing impairment through the use of personal listening devices. So this is the whole set of the guidelines which we developed, but linking directly to the leisure noise and the challenges in formulating the guidelines, I would like to mention about another WHO initiative, which is in a way complementary to the guidelines, initiative led by the colleagues in WHO headquarters in Geneva, who were working under the Safe Listening Initiative with the International Telecommunication Union to develop standards to prevent hearing loss in young people. And just last week, a document and a new standard was published, and you can find information on the WHO website. And the idea of this initiative and standard is really to improve listening practices, especially among young people, because globally, I mean, the figure is really regretfully impressive. That the estimates are that almost half of young people, meaning more than 1 billion young people, are at risk of hearing loss due to prolonged and excessive exposure to loud sounds, including music listened through these personal devices. So this standard was developed again through a very much consultative process, and it is offering a number of, covering a number of features, for example, some functions in the devices on the sound allowance, or getting a personalized listening profile, different options for limiting volume, and some general information. So those who work in this area may find this resource also very useful. We are now in the phase of thinking what to do next. There is guidelines available. We have now these standards. So from our perspective, we would be working with member states to support them in the implementation of the guidelines, also being aware that this is an activity which requires this you can say whole of government, whole of society approach, where both government but also other bodies, civil society, and people are involved. So to support this interaction, and also to frame noise and health in the broader context of environment and health agenda, linking it to the Ostrava Declaration, Sustainable Development Goals, as part of the sustainable development of cities. And at the very end, just to recap the guiding principles which were used in our environmental noise guidelines, which is to reduce exposure to noise while also conserving quiet areas, promote interventions to reduce exposure and to improve health, coordinate approaches to control noise, but also in connection with other environmental health risks, even though the guidelines per se are not looking into this multi-pollutant model because it wasn't feasible, but in terms of actions, coordination is critical, and inform and involve communities that are potentially affected by a change in noise exposure. So thanks a lot for your attention, and I will be happy to answer questions, if any.
Thank you very much, Dorota. Actually, this was a lecture on not only on the very specific topic of noise, but also in terms of how to build such a complex publication guidelines, and also thanks for reminding us about the difference between guidelines and standards and limit values. It was also very interesting and fascinating the part of the presentation about the quality of evidence, and I was actually surprised to see that, for instance, for railways noise, I mean, we all have experiences in going to train stations, for instance, and hear how disturbing such noise can be, and we can imagine also how it can be for people living close to stations or railway tracks, but still evidence is rather weak on that, as far as I understand. Thanks also for pointing out about the balance between benefits and harms. Yes, definitely we all enjoy going on holiday by plane, and actually it would be very difficult to imagine that we go to the United States, for instance, by sailboat, which would be definitely less noisy, but it would take a bit longer. So there are lots of consideration to make, and I would like to start by asking myself a question while I ask all the participants to channel their questions through the chat. If you can, if you have any request for clarification on this very interesting presentation, please write your question in the chat. In the meantime, I would like to ask Dorota about the media coverage that these guidelines raised. I know that there was a official presentation of this report, and that it was picked up by lots of media. And I was wondering, was it expected by you, Dorota, and also by WHO, this kind of reaction by media, and what were they more interested in? And also in which kind of source of noise they were more concerned, and whether you think that it was also a reflection of what communities think. As you pointed out in one of the last points, it's very important to involve communities also in the development of the recommendations for making them actually happen in practice. So can you provide us a bit more insights on what happened when the report was launched?
Of course, gladly. Indeed, the launch event was organized in the following way. We had a virtual press conference from Bonn, and then the following day we had a physical launch event, which was designed as a day-long symposium, kindly hosted by the Swiss in Basel. So we had the official unrevealing of the guidelines, but also a series of panel discussions. And indeed, the media coverage was surprisingly rich. We did not expect that this topic would trigger so much interest. It got a very wide coverage in the mainstream media in Germany. We heard that it also in the US, in the UK, even in Australia. We were also very happy to see a coverage in the Russian media. So it was indeed very wide, which we of course welcome, because as mentioned in the beginning, noise is not always really seen as an environment and public health issue. So this was a very positive experience. I am sure that the fact that we had this virtual press conference, that we had all the press materials, that we had executive summaries in 4 official languages of WHO Euro, it really facilitates this. And overall, this media coverage was very, I would say, constructive. Relatively much attention went to aircraft noise. And in addition to the media coverage, there is, since October and until now, we know that there is this very dynamic process going in the EU member states, and we also got some feedback from stakeholders. And I would say that so far the major challenges are related to aircraft noise, because it is indeed for the first time that the guideline values are formulated and which really impose some demands on this sector. But of course, as mentioned in the beginning, the guidelines are public health recommendations. So the process of feasibility of making infrastructural or other interventions, this is a part of the discussion which is on the implementation side. So this. What else can I say? It's more a reflection that when we were identifying in the process stakeholders from the civil society, I would say it was surprisingly few. I say surprisingly because we quite often are confronted with these voices of concerned citizens. However, for some reason, this is not featuring so prominently if I think of civil society groups or associations that we work with. We got some representatives, but this was the aspect which surprised us a little bit, I would say.
Thank you very much. Please don't be shy and take the opportunity to ask questions to Dorota, as it's a very rare opportunity to have this top expert with us available. I would like to take advantage of asking a specific thing about road traffic noise. I was myself surprised by seeing the large effect that road traffic noise is having on health. I mean, that was my first field of expertise in terms of road safety, but in terms of like crashes and these kind of things, this is a different aspect for me. And among the recommendation, I see that the guideline group recommends reducing noise both at the source and on the route between the source and the affected population. So it means that there might be measures on the infrastructures, for instance, I mean, noise
Yes.
barriers or whatever, but also there must be a dialogue with car or vehicle manufacturers, like the source of the pollution, noise pollution in this case. What kind of engagement do you see with the private sector then? I mean, I understand that this is a very political maybe debate, but as you were also discussing about the future implementation of these guidelines, I mean, I guess that this is a crucial point because this is one of the main sources of noise pollution. So how do you see that happening?
I mean, this is a very valid point, and I think this exemplifies many other domains where interacting with commercial sector, be it chemicals, be it pharmaceuticals, this is a very delicate, let's say, way of interacting between us and commercial sectors. But referring to the document and to the statement you referred to, this was also meant in a more general sense. That first of all, because yes, indeed, with interventions, I didn't want to go into these details, but there is at least 5 or 6 types of interventions from source to individual behavior, and which involve also infrastructural changes. So this was more an encouragement and a statement that this recognition of the public health relevance and the benefits to public health, this also needs to be somehow incorporated in the discussion also with those who are generating this noise, so that it's not only perceived as a completely external burden of them, but more part of the responsibility and kind of internalizing these implications. So this is this is more in this sense that the dialogue may be clarifying what is the health relevance, and to include health considerations at the end, let's say, of the product, also with those who are generating. So this is also part of this distributional dimension of benefits and harms.
Thank you, Dorota. We have a question about, I'm reading it. I was wondering if a tool like AirQ Plus will be implemented in order to quantify healthy life lost due to environmental noise. I know that you are also the top expert of these tools, so maybe you can address this question.
I wouldn't like to be too committal, but it is something that we are discussing and we are considering. Because indeed, we are also thinking that having such a tool might be very useful. So we are considering it and looking into feasibility of it. So I do hope that if you run another series of tool webinars in the future, maybe we will also have a tool like that. But I cannot say it has been decided yet, because there are many factors, from content to resources on our side. But this is what we are contemplating and very seriously looking into.
Thank you very much, Dorota. And actually, one of the aims of running these WebExes is also to hear from participants how you can actually enrich your tools. And this is one of the suggestions that maybe you can report back to the panel of experts. We have another question about the translation of these guidelines in other languages. Is it available in Russian, or is it foreseen in other languages also of WHO Europe? Official languages?
We have only executive summaries in 4 official languages of Europe, so this is available in Russian, but not the whole guidelines. We were not planning translation of the guidelines as the whole document, for the availability or lack of resources to support it. But we also are open to hear these voices, and should kind of a critical mass be reached, we would see whether we could raise some funding, but it's not planned now for the lack of resources.
Thank you, Dorota. And also there is another, comment, maybe more than a question. Is there any evidence of the effect of social media noise? So this is maybe a new category that could be included as a contributing factor to negative health outcomes. I guess that this is a comment. But social media was also something that was picked up, when the launch, for instance, of the guidelines were made, right?
Yes. It was picked up, so it was one of these positive impacts. But I couldn't say this is also certain, dynamics, which I think is typical also for this social media pickup of things, that there is this very peak, and then, but it's nothing that we would get a more structured or strong feedback to us.
Okay, thank you. And one question that I had is about the railways quality of evidence. Is there a specific reason why there is no much evidence around that, or is it because it's like for something which is difficult in collecting evidence methodologically for railways noise, or why is that?
In fact, it came even to the group of experts as a bit of surprise. There was this sense among the experts that maybe we shouldn't expect too much, but it was a bit surprising how little there is. I cannot give a single answer to this. I believe that partly these studies are methodologically demanding, and probably this was really the factor. Maybe paradoxically, the publication of the guidelines and showing up the deficits in the available evidence may be a prompter for further studies, because on one hand, there are guidelines developed based on this what is available, but on the other hand, this type of mapping and grading of this evidence is also pointing up to important gaps in the evidence. So we also hope that this will prompt further research, and in the guideline document there is also the chapter on the future and then the research needs. So hopefully when revising the guidelines, I don't know, maybe in 10 years' time, we would be having more complete evidence also on those areas which are now lacking or which are not as rich as we would wish for.
And one last thing, Dorota, about the leisure noise, living in a very noisy city, despite the fact that some people might think it is not. Venice is very noisy, especially in some parts of it. I was struck by the fact that there is not much evidence around that. And on the contrary, one of the last slides that you presented, saying that this alarming figure, 50% of the population between 12 and 35 years old is at risk of hearing loss. So on the one hand, we don't have evidence, as far as I understand, strong evidence. And on the other hand, we have a huge amount of the world population which is at risk of hearing loss.
Yes.
How is it possible, and what can be done? Because this is quite alarming, actually. It was the last figure that you presented, and I think it was also the infographic that you presented. The image that was used is very powerful with this broken egg. Very interesting.
Yes, I must say that indeed colleagues from Geneva, I think, use a very suggestive image. So I was also impressed by this communication means, and indeed the issue is alarming. So we are also very happy to see this standard being released. Of course, again, it is a voluntary standard, so it is up to member states to pick it up. But from the perspective of the guidelines, it indeed very nicely complements. It focuses on the hearing impairment, and I would say, regardless of the quantifiable evidence on the magnitude of impact, they are jumping straight to interventions. So this is it. But yes, indeed, the evidence is very poor, and in fact, this was one of the recommendations that was subject of the very long and very vivid discussions, because colleagues really wanted to formulate a recommendation being aware, even if not underpinned by quantitative studies, of the magnitude of the issue. But this is as far as they could get with formulating recommendations. And again, I think that part of it is methodological challenges when it really comes to assessing exposure, and when we are talking about exposure, which is linking it with the longer term health impacts. On the other hand, we have this huge pressure coming from the promotion of these devices and this wide cultural and societal acceptance of these behaviors. So I would agree that this is one of the more demanding areas for activity of public health practitioners, because with these sources like road traffic, aircraft, even wind turbines, there is some overall sense that, okay, there is noise associated and it can have impacts on our health. While with this leisure noise, which is part of the behavioral aspect, this may require, and also thinking of a target group, which are young people, this is something which may require indeed a different approach and more, I would say, even creativity from the public health community to really prevent impacts in the future.
So, Dorota, thank you so much for this super interesting presentation that you gave, and also this interesting discussion that we had at the end. And thank you also very much for your work in this area of work and for coordinating such a massive undertaking. Again, I'm sure that this will be very important for this field of work. So thank you very much for also your broader contribution to this. And thanks again to the Bonn colleagues, and thanks to Andrea for his technical assistant throughout these webinars. I would like to thank all of you for the participation not only in this webinar but also in the previous ones. It was really a successful initiative. We were overwhelmed with positive comments about that, so we want to continue that. It will be on different topics. Most probably for this year it will be around equity, which is one of the most important themes of WHO Europe this year. But of course we will continue updating you, and you will be receiving from me information about our future plans. You also know that you can find this webinar and also the previous ones on our RHN YouTube channel. And also, actually, there were very many views, so I was also impressed by the results that we got. No doubt that the topics that were proposed with the environment and health tools were super interesting, and our colleagues hyper competent. So once again, thank to all of you for your time and your participation, and once again, thank to Dorota for her time today. A warm welcome from me, from Francesco and Andrea here from Venice, and I hope that you will enjoy a pleasant weekend ahead. Thank you very much, and bye-bye.